morning and welcome back. Well, it affects millions of Americans, and many of you may know somebody who's affected by multiple sclerosis. And to explain a little bit more about what that is and how it affects people, Larissa Nimocks from Gundersen Health System joins us this morning. Larissa, thanks for waking up with us.
Yes, thank you. Good morning.
So multiple sclerosis, brief overview, what exactly is it? How does it affect people?
Multiple sclerosis is considered to be an autoimmune disease, which is a disease where one's own immune system sees part of the body as foreign and ends up attacking that part of the body. In the case of multiple sclerosis, the immune system attacks something called myelin, which is a protective covering over the nerve cells in the central nervous system, which is the brain, the spinal cord, and the optic nerves. So any damage to that myelin can affect the way that the nerve functions.
Yeah, and the way that the nerve functions can affect your body as well. What kind of symptoms does this cause?
And again, it depends which nerve is affected, which symptoms a patient might have. More of the common symptoms that we see are changes in vision, generally double vision or loss of vision. We can see numbness, tingling, or weakness in the trunk or in any of the limbs. It typically happens on one side of the body. People can have changes in balance, dizziness, vertigo type symptoms where they feel like their world is spinning around them. And fatigue is also a very common symptom of MS.
Now, are there differing levels of severity of multiple sclerosis? Because I've known some people who've had it who seem like they don't have any symptoms, and then others who seem like they have a lot more effect of the disease.
Yes, that's a great question. About 85% of patients present with what's called relapsing remitting multiple sclerosis. So they might have this, immune system process affecting the nerves, and then they have a period of time where they get better and may be asymptomatic for many years. More rarely, we have patients present with a more progressive type of multiple sclerosis where they'll have symptoms and then they'll gradually progress over time.
Okay.
Yeah, and Larissa, are there any what type of medication or any type of way to deal with these symptoms?
Yes, there's many approved treatments for MS. There's no cure for MS. However, there's many medications that can help to slow the progression of the disease. And early treatment has been shown to show better outcomes, so it's very important to get that diagnosis as early as possible. There are also many both medicine treatments and non-medicine options for treatment of symptoms.
Yeah, certainly a lot more. I feel like we're just scratching the surface with this. Larissa, thank you though for providing some more information about it this morning.